Good morning, AXA! This is Mark Inares, your DLND Health Champion, and welcome to another edition of Health Check. So mga health checkers, I'm sure alam niyo na kung ano yung features and benefits ng health products natin. But did you know, here at AXA, we are also offering a full suite of health services? Kasi syempre, we want to stand as the health partner of our customers. And to discuss one of these value-added health services, we have with us today our segment director from Retail Propositions, Mr. Tony Isidro. Good morning, Tony.
Good morning, Mark. Good morning, AXA. It's an honor to be here.
Yeah, thank you, Tony, for gracing us with your presence. So as we mentioned nga, we will be talking about one of our value-added health services. And this service is Preferred Consultation and Care. Tony, can you tell us more about Preferred Consultation and Care?
Mark, Preferred Consultation and Care is a value-added service we currently offer our customers, which gives them access to best-in-class medical advice. So think of it as second medical opinion, which our customers with heart disease or cancer can get from Harvard-affiliated doctors from the top 1% of US hospitals. Now, part of the service is also what we call a personal care manager, who are medical practitioners who assist our customers from the start of the journey till the end.
So Tony, sounds like a very good service, no? But maybe we can also give our viewers an idea of why we are offering this service for our clients, for our customers.
Maybe ang unang tanong ng mga distributors natin, bakit heart disease and cancer lang yung nakafocus yung service, no? And that's a very valid question. The fact is, these two diseases, heart disease and cancer, are the top two causes of death among Filipinos. In fact, the sad reality, Mark, is that daily 33 Filipinos die of cancer. And so with this reality, we want to be able to be of service to our customers via this service, which, as we mentioned, is called Preferred Consultation and Care. Now, for those of us, for our customers or distributors who've had family members undergo these two diseases, alam natin hindi ito madali. It's a very stressful time, not just for the patient, but for the entire family. And that is where we can be of service to our customers. So we're not offering the cure, we're not promising mawawala yung sakit ng customer natin, but where we come in is that we can empower our customers by giving them the opportunity to and access to information and therefore make better informed decisions together with their family as to how they will go about their condition. And with that, there is more hope and they can feel more empowered as they face this and so that they can focus on their recovery.
Yeah, alam mo, agree ako dyan, Tony. Diba sabi nga, alam natin, diba, anytime meron magkasakit na malala, hindi lang yung taong may sakit, hindi lang yung pamilya. Diba, buong angkan nagtutulungan pagdating sa mga ganyang bagay. And really, definitely, it pays, diba, if you can get help, saan ang lahat ng available sources, diba, pwede mo pagkunan ng tulong, gagamitin mo yan. Yeah, I think pagdating sa mga ganyang bagay, no, more than before, information is power. And with our PCC, our Preferred Consultation and Care na service, ama ba, Tony? Diba, we are giving our clients, our customers, access to the best medical information?
Correct. Information is key. Information is power, as you mentioned. Tama yan, Mark, especially when faced with these conditions.
Yan. So, Tony, when it comes to providing our customers with the best possible medical information, sino ba yung kapartner natin to make this service available for our customers?
So for this Preferred Consultation and Care service, we are proud to partner with an organization called Preferred Global Health. Yung Preferred Global Health is a US-based organization in Boston specifically, who has over 2 decades of experience in this field, meaning they're able to connect patients with top-notch medical advice. They are partners with some of the top insurance and financial companies in the Middle East and Asia. In fact, in Asia, for instance, they have presence in Vietnam, in Hong Kong. In Hong Kong, in fact, they are partners with HSBC, and HSBC has been offering this service to their high net worth customers for over a decade already. I think that speaks of the experience of this company in being able to deliver its commitment, in terms of bringing top-notch medical advice to patients of heart disease and cancer. In the Philippines, we are proud, and we can all be proud to say that AXA Philippines is the exclusive partner of Preferred Global Health in bringing this service to the country.
So that's very remarkable, no? So definitely, we can say with confidence na tayo lang yung makakabigay ng ganitong klaseng service, no? No other companies, no? And that's a feather in our cap. And kudos to AXA for making this possible. Siyempre, yung kliyente natin, customers natin, yung pinaka-makikinabang. And of course, Tony, since nagiging mas interesado na tayo on this preferred consultation and care, no? Can you give us an idea or diba, ano ba yung mga variants, ano ba yung mga available na variants itong PCC?
That's a very good question, Mark. There are actually 2 variants which we currently offer to our customers. The first one is what we call Preferred Consultation and Care Lite, or tawagin na lang natin PCC Lite. Now, this has 2 elements. The first one is what we call diagnosis verification and treatment plan. The second is what we call a doctor-to-doctor dialogue. Ngayon, sige, let me explain that a bit more. Alam naman natin that heart disease and cancer are very complex diseases. And this is where diagnosis verification comes in. So, paano ba nangyayari yun? So, once our customer has an initial diagnosis from his or her local doctor, the patient can then submit it. And what happens is that as part of the service, we will be putting together a team of specialists. No? So, hindi lang isang doktor, but really a combination of doctors from different fields to look at the patient's case. And it's going to be very personalized. It's going to be based on the specific condition of the customer. And we will return to the customer with a specific review and recommendation based on his condition and upon review of those specialists. Sabi nga, di ba, 2 heads are better than 1. And in this case, hindi lang 2 or 3, but really a team of specialists who have a lot of experience in these 2 fields. Now, as a second part, nabanggit ko rin, Mark, yung doctor-to-doctor dialogue. So, pag nabigay na yung proposed treatment plan sa customer natin dito sa Pilipinas, if the customer wants to, we can connect his or her doctor dito sa Pilipinas with those doctors in the US hospital so that they can talk in more detail and come up with a more holistic treatment plan for the customer. So both those elements, yung diagnosis verification treatment plan and doctor-to-doctor dialogue, are part of the first variant, which we call PCC Lite. Now, there's a second variant, which is the main PCC variant, which includes these first 2, but also includes a third element we call US Care. And what that means is that if the customer opts to get the treatment in the US, then we can assist the patient in that endeavor. Now, to clarify, the cost of the treatment, nasa customer pa rin po natin yon. So, it's the customer who will still pay for the travel and for the actual treatment in the US. The service comes in terms of a personal care manager assisting that customer, whether in terms of the travel arrangements from the Philippines to the US, pagdating doon sa US in terms of transportation service, kung kailangan ng ambulansya from the airport to the hospital, to choosing the doctor, to making appointments, and hanggang sa dulo, Mark, in terms of reviewing the bill pag when the customer will be discharged. That's all part of the US Care service that we offer for our customers as part of the service.
So itong personal care manager, no, will really come in handy, especially pag ganitong klaseng mga kaso, di ba? Cancer patient, heart disease patient, di ba? We are definitely dealing with a very delicate matter. Even the fact na, di ba, mahabang flight yan papuntang US. So very important na pag nasa US na yung pasyente, di ba, he or she will get access talaga, meaning wala na talagang delays, di ba? Everything is laid out, everything is set out. And I think that's the very purpose of the personal care manager, meaning end-to-end talaga. So the client can really focus on, di ba, yung recovery niya, getting better. Di ba? Less worries, better chances of recovery for the patient. And that's available for our standard PCC variant, no? Pero even with the light version, di ba, itong diagnosis, verification, and treatment, kailangan niya. Again, we need all the information we can get. Access to the best medical information will be there. And aside from that, yun nga, yung doctor-to-doctor dialogue. Kasi syempre, kung yung mga doctor sa US, ibigay sa pasyente or sa client natin yung treatment plan, diagnosis, hindi rin natin mako-communicate ng maayos, di ba, with yung doctor dito sa Philippines. So it's really maganda, diretso rin nag-uusap yung dalawang doktor, or actually the doctor here plus the team of doctors in the US. So they would really, diba, get their heads together and come up with the best possible treatment plan for our patient, for our customer. Tama, Tony?
Tama. And in fact, you mentioned yung personal care manager. And I think it's important to share, Mark, that the personal care manager are also medical practitioners. And more importantly, you have one personal care manager assigned to the patient from start to finish. So alam yung history ng customer, and therefore ma-assist talaga siya, no, every step of the way until as we mentioned, no, until kung mag-avail siya ng US Care, until ma-discharge ng hospital. And the personal care manager will be present from start to finish talaga.
Yeah, so train talaga, alam niya yung intricacies, di ba, how to deal with a patient, di ba? Lalo na cancer patient, heart disease patient. So very important na really that trained talaga yung tao na magbabantay, mag-aalaga sa pasyente natin, sa customer natin. Yan, so I'm sure yung mga listeners natin, mga distributors, are very interested and excited to offer this value-added service for their customers, no? And baka tanungin din nila, teka, yung mga customer ko ba qualified? Ano ba yung eligibility requirements, or ano ba yung produkto na kailangan nilang kunin sa AXA in order to avail of itong PCC? Can you share us a few details about that, Tony?
So currently, the PCC service is available to our single-pay customers as well as our HealthMax customers. So let me discuss that in greater detail. Ano ibig sabihin nun? So for single-pay customers, for those with combined net premiums with us of at least 5 million pesos, they are eligible for PCC Lite. So if their combined net premiums, on the other hand, totals 10 million pesos and above, they will now be eligible for the PCC standard variant. Now, to further clarify, when we say single pay, so that includes products like Asset Master, Ambition X, or kung meron pa tayong mga customers na may honeypot, kasama po lahat yon. Ang hindi lang kasama would be those PGX policies. But otherwise, all the single pay policies I mentioned will be part of that aggregate eligibility requirement.
Okay, sounds good. And Tony, when you say combined net premiums, ibig sabihin ba nito, hindi lang kailangan sa isang policy lang mabubuo yung 5 million or 10 million? So it can be yung total, yung combined sum ng mga premiums na kinuha nila sa mga single pay policies nila?
Yes, tama yun, Mark. So it's a combination of all single pay policies. And as long as they meet the net premiums paid, whether 5 million or 10 million, they will be eligible already.
Yeah, and this is based on yung insured, no? Not the policy owner?
Yes, correct, Mark. It's based on the insured.
Yeah, so good to know, Tony, na itong PCC is available for a wide variety of our single-pay customers. No? But you mentioned also, Tony, that itong service will also be available for our HealthMax customers.
Yes, that's correct, Mark. Some of our distributors will probably know, no? Starting March of this year, March 2020, we started offering PCC as a value-added service for all customers with sum insured of at least 1.2 million pesos. But the good news ngayon that our minimum sum insured for HealthMax is 1.2. So effectively, lahat ng HealthMax customers natin are eligible for PCC Lite. Now, we previously announced that this offer is available until December 31 only. The good news, and I'd like to take this opportunity, Mark, to announce to everyone that this offer is now going to be extended until March 31, 2021. So again, what that means is that all our HealthMax customers are eligible for 1 year PCC Lite service within this offer period.
Hey, so that's very good news, Tony. Again, guys, mga listeners, you heard it here first on Health Check, no? Pero Tony, I think aside from the product, na-mention na natin yung kung saan products available itong PCC, no, and PCC Lite. What about yung mga underwriting requirements? Meron bang additional na kailangan i-fulfill yung customer natin on top of kung ano yung requirements sa HealthMax or yung single pay policy nila?
So I'm sure, Mark, yan din yung tanong ng mga nanonood sa atin na distributors ngayon. Actually, the good news is that there are no additional underwriting requirements for our customer to avail of PCC. So for as long as they have an active or in-force single pay policy or policies or HealthMax policy with us, and they meet the eligibility requirements I mentioned earlier, yung 5 million or 10 million for single pay and at least 1.2 for HealthMax, they automatically will be part of this service.
Okay, again, good news na naman. Siyempre, wala nang additional na kailangan isipin yung kliyente. Diba? As long as they have this HealthMax policy or yung single pay policy, tapos maintain nila, then they get to enjoy this Preferred Consultation and Care service. Pero last question, Tony. Diba? Napakagandang service nito. International access, team of doctors abroad, doctor-to-doctor dialogue, baka may personal care manager pa. Diba? Baka naman magastos or mahal to, Tony. Baka may additional premium pa na kailangan bayaran yung customer on top of the premiums that they are paying on their existing policy. So, long story short, diba, magkano ba to? How much will this service cost?
Mark, it's a value-added service. So meaning, walang babayaran yung customer natin to be able to avail of PCC.
Okay, ganun kasimple. Guys, handaan nyo. Wala nang bayad, wala nang kahirap-hirap. Diba? So our clients can already get to enjoy the benefits of their existing single pay or HealthMax policy, and they get to enjoy the Preferred Consultation and Care service for free. So ulitin ko na ito, I just have to ask again, no? Wala tong additional charge since this is a value-added service, correct?
Wala. Again, to recap, for single pay customers, as long as they meet yung 5 million or 10 million, they're automatically enrolled in the PCC service. And then for HealthMax, from now until March 31, 2021, all our HealthMax customers will get PCC Lite for 1 year.
Okay. So tama nga yung narinig ko. So hindi ako nagkamali sa narinig ko.
Tama yung narinig mo, Mark. And in fact, by the way, very soon we will also be offering PCC via a third product, which is Health Start. So just watch out for announcements on that in the coming days.
Wow! Salamat na salamat, Tony, sa magandang balita that our clients get to enjoy this value-added service at no extra cost. So itong Preferred Consultation Care is really something that we can be proud of and we can showcase to our customers. So before we end, Tony, do you have any parting words for our viewers today?
Again, Mike, thank you for this opportunity to join you in this program. And I just wanted to share again with our distributors, this PCC service is something we can be truly proud of. We are the exclusive partners in the Philippines and among the major players, we're the only ones who are able to give this kind of service to our customers. And as I mentioned earlier, we're not here to give the cure or to tell our customers mawawala na yung heart disease or yung cancer nila. But why we're here is that we can offer this service so that they and their families can make better informed decisions regarding their conditions. And so with that, they can hope better and they can truly focus on what matters. And what matters is their family and their recovery. And that is where we can help our customers.
Thank you very much, Tony. I couldn't have said it better myself. Oh, mga health checkers, ano pang hinihintay nyo? Tell your clients that on top of the best-in-class health product or single-day product that they're enjoying, they also get to benefit from a superior value-added service such as Preferred Consultation and Care. Thank you very much. Again, this is Mark Inares, and this has been Health Check.